This is a quick run through on clinical registers, demoed here on the Socrates platform. IPCRN, one of the first tools that we collaborated on was the creation of clinical registers. You can find them here under Reports and then click on IPCRN Tools on the Socrates platform. One of the first registers we built was a diabetes register. Double click on the diabetes register here, and what it will do is it'll run through your entire patient population and find anybody who's coded with diabetes. It gives you an overview at the beginning, 26 patients coded with type 1 diabetes, 107 type 2 diabetics, and no patients in this test database are coded with gestational diabetes, so it gives you a total there of 133. As you scroll down, you'll get more information, and we've scrubbed out names and addresses here. They're all Joe and Mary blogs. All the phone numbers and medical card numbers are the same. So you can see these gives you a list of all your type 1s first of all, name, surname, date of birth, address, over as far as HbA1c level, the most recent HbA1c result and the date recorded. And as you scroll down you'll find patients that maybe haven't had bloods done for a while. Scroll down further and then you'll get a list of all your type 2 diabetics that are coded, first name, surname, date of birth, address, phone number, scroll all the way across to HbA1c result again. Anywhere that a patient's most recent HbA1c result was in the normal range, you'll see a green band like this. So that's the diabetic register. We then progressed on and built some other chronic disease registers also. Click on administration here and you'll see the clinical registers button. And what this does is brings back patients with any of these 6 major chronic diseases. Asthma, for example, just click on asthma, click OK, it'll give you a list of all your asthma patients, 83 in this test database here. It's pretty fast, usually only takes a few seconds to bring them back, and it tells you what disease codes it's pulling. It'll pull patients with either asthma coded as type 1 or as ICD-10 or ICPC2, and it'll strip out any duplicate patients as well. Some practices don't click active after they code someone with a chronic disease, and that's okay. You can just unclick the active button here, and this is an example in AFib. Unclick the active button and that'll bring back anybody with a code of atrial fibrillation. It doesn't have to be active. So for those of you that don't use the active status for some of the disease codes, that'll sort that out. That's the clinical registers, and I hope you find them helpful.